Medicare Advantage plans, also known as Part C of Medicare, can be a pretty polarizing topic. Some people will tell you they love their Medicare Advantage plans, others will warn you to stay away from them. So are Medicare Advantage plans bad? Today, I'm doing a quick breakdown of the good and bad parts of Medicare Advantage so that you can make an informed decision on whether or not you should avoid Medicare Advantage plans, so stay tuned. Now, Medicare Advantage plans are also known as Part C of Medicare. It's kind of an optional way to receive your Medicare benefits. If you enroll in a Medicare Part C plan, these are like HMO or PPO type managed care plans, then essentially the plans replace your traditional Medicare benefits. And what I mean by that is when you go to the doctor or hospital, you're no longer showing them your red, white, and blue Medicare card anymore. You're showing them your Medicare Advantage plan card. And the Medicare Advantage plan is the one that is approving or denying or paying on your claim. One of the great things about Medicare Advantage plans is that they are usually $0 a month in most parts of the country. Most plans that I recommend for people will have a $0 a month premium. These plans also include Part D prescription drug coverage rolled right into the plan usually. Now, how can a plan be $0 a month and include prescription drug coverage? Medicare Advantage plans are paid directly from the government for every enrollee. They get a pretty hefty lump sum every month from the federal government whenever they enroll a Medicare beneficiary. And because of that, they are able to pass along those savings to you in the form of a $0 a month premium plan. Now, you still have to pay your Medicare Part B premium in most cases when you're enrolled in a Medicare Advantage plan. So even though the plan kind of replaces your traditional Medicare benefits, you're still paying your Part B premium, which this year is $174.70 per month. Medicare Advantage plans also include extra benefits. So a lot of these plans will include things like maybe dental or vision or hearing services that are not covered by traditional Medicare. And again, that's rolled right into the $0 a month premium plan. Now, with the implications of the Inflation Reduction Act, which I'm going to talk a little bit more in another video about, you may see a decrease in some of these extra benefits on certain Medicare Advantage plans. So you want to keep an eye out for that as Medicare Advantage plan benefits change year to year. These are calendar year contract plans. So when you enroll in a plan, it's for that calendar year. The plan benefits can and do change every year. And there's an annual open enrollment period from October 15th to December 7th where you can change to a different Medicare Advantage plan if you'd like to. So with all of these great benefits, why do Medicare Advantage plans get such a bad rap? Let's talk about some of the cons of Medicare Advantage plans. The first big con is going to be doctor networks. So these plans, like I mentioned, are HMO and PPO plans, managed care plans. And what that means is that your doctor or hospital may or may not be in the network for the plan. The plan networks can change from year to year. They might change in the middle of the year. And if your doctor suddenly stops taking your plan in the middle of the year, you don't necessarily get a special enrollment period to change that plan, right? Like I mentioned before, they're calendar year contract plans. So you're kind of locked into that plan for the full calendar year. Another thing to consider with Medicare Advantage plans, especially when you're comparing them to Medicare supplement plans with traditional Medicare, is going to be the co-pays and co-insurance amounts that you will be responsible for. So on most all Medicare Advantage plans, you have an out-of-pocket responsibility. You're going to pay a co-pay or co-insurance amount for your network services. And you'll pay until you've reached your plan's out-of-pocket limit. The out-of-pocket limit this year can be up to $8,000 a year or more for in-network services. So if you're comparing Medicare Advantage to Medicare Supplement, you do want to be aware that on Medicare Advantage, you may see a higher out-of-pocket maximum that you could be responsible for if you are using your plan services. Now, to me, the biggest con of Medicare Advantage plans is going to be prior authorization. I'm going to put a star next to this one because it's really important to know about. Now, there's a ton of data on this. I'm going to link it below, but virtually all Medicare Advantage plans require some form of prior authorization for major services. Generally, higher cost services, things like inpatient hospitalizations, surgeries, Part B medications like chemotherapy are going to be more likely to be subject to prior authorization than other lower cost services. Even some supplemental benefits like hearing benefits or transportation benefits may be subject to prior authorization on these plans. A prior Kaiser Family Foundation analysis found that over 35 million prior authorization requests were submitted to Medicare Advantage insurers in 2021, with over 2 million of those requests fully or partially denied. Now, just 11% of the denials were appealed, although 82% of the appeals were at least in part successful. So that means that a ton of care is being denied that actually shouldn't be denied, and not enough Medicare Advantage enrollees are going through that appeals process when they're getting denied a service. Now, the government has been trying to crack down on the mismanagement of these prior authorizations so that seniors can get the care that they need in a timely manner. CMS recently finalized 3 rules with provisions pertaining to the use of prior authorization. With these changes, they are trying to shorten the time frame within which Medicare Advantage insurers are required to respond to prior authorization requests. So you're not sitting there waiting for days and days and days on end before you can get the urgent care that you need. However, I do want you to check out the report that I've linked below, because even with these CMS changes, there are still a lot of holes in the data that Medicare Advantage insurers are required to report. So even with the new rules aimed at improving care on Medicare Advantage, it feels like we still have a little ways to go. Another very important thing to know is that if you opt for a Medicare Advantage plan and later on you want to switch to traditional Medicare with a Medicare supplement plan, you may or may not be able to, depending on where you live and your health. So when you are new to Medicare, if you choose to go with traditional Medicare and add on a Medicare supplement plan, also known as a Medigap plan, to cover the 20% that traditional Medicare doesn't pay, then you can enroll in any Medicare supplement plan that you choose when you're new to Medicare. But when you're new to Medicare, if you go with a Medicare Advantage plan and then later on, years down the road, you decide this plan isn't working for you, you want to drop it and go to traditional Medicare and add on a Medicare supplement plan, you may or may not be able to. It's going to depend on your health. Medicare supplement plans are medically underwritten when you are not new to Medicare in most parts of the country. And that's something that many people don't realize. So the decisions that you make when you are brand new to Medicare are very important and could impact you for the rest of your lifetime on Medicare. Now, are all Medicare Advantage plans bad? No, I don't believe that all Medicare Advantage plans are bad. I think that for some people in certain parts of the country, in certain situations, these plans can be a very good fit. However, it's really important to know about the pros and cons of Medicare Advantage so that you can make an educated decision. Now, here in my office, my team and I help people every day to help decide which type of plan is best for their needs and their budget. We work with Medicare Advantage plans and Medicare supplement plans. We represent over 30 different insurance companies. We're licensed in almost every state, and our service is completely free of charge. So many people that find us right here online will give our office a call, and we have helped thousands and thousands of folks to find the best Medicare coverage for their needs. So feel free to give us a call. You can send me an email at any time, and we'd be happy to help. Thanks so much for watching, and we'll see you soon.